Are you a veterinarian or are you currently already in the industry as in a corporate level and you've wondered, how do I move from, say, a vet into the industry or moving from that industry into the global platform? If questions like this arise in your career at the moment, you should probably have a listen to this. She started as a vet. She is now the president of Asia and Africa of the world's leading animal health company. So, how do you go from a clinic in Australia to the boardroom of a global giant? Stephanie Armstrong sat down with me and has spent 20 years mastering the transition from technical expert to corporate visionary. She's lived it, breathed it, and led across four continents. Today, on the show, Steph shares her unteachable lessons. Welcome to the Animal Health Show by S8. I'm your host, Shannon Wood, and this is where we talk about the latest trends shaping the animal health industry. We'll be sitting down with leading voices from across the sector, sharing practical insights to help you grow your animal health business, build a stronger team, or land your dream role. If you're looking for your next dream job, or you're ready to hire your next standout team member, reach out to us at S8 Expert Recruitment Solutions. You'll find our contact details in the show notes for today's episode. All right, let's talk animal health. Hello.
Hey Shannon, how are you?
I'm really good. How's things?
Very good. Yeah, very good.
Thanks for coming on. It's really cool.
I've been out of Australia now for, I think this is coming to our ninth year, I think, 8 or 9 years, something like that. But time just flies.
Yeah.
In a heartbeat, suddenly you're 9 years later going, oh my God, how did that happen?
Yeah, I know. But you've started your journey in clinics of Sydney and back in 97 and
Oh,
then
oh my
graduated
God.
Sydney University and then your career expanded from a global technical role, not global, but you worked for a massive global business, which was Fives Animal Health, and then in Australia in your executive leadership, and we all know that Zoetis today, and then you've been working in Dublin, New York, London, and now you're the regional president of Asia Pac and Africa, one of the world's leading animal health companies. And
Yeah.
yeah, that's pretty cool. It's super. Your background is like someone that probably a lot of people just dream to have and be.
Yeah, look, that's you to say, but I think I've been very fortunate to be able to take advantage of opportunities as they've arisen. And I think a lot of what I see is just whether or not people are willing to take those risks. It's not that I have some unique skill set that has unlocked this opportunity. It's just that I was willing to put some risk into some of the moves that I made and they've paid off. And I've been, a lot of it is timing. Are you in the right
Yeah.
position at that moment? The opportunity comes up and you're willing to take that risk and your personal situation allows it and all that kind of stuff. So yeah, I've been very fortunate, but I absolutely love having a global career. It's been super exciting and interesting and hopefully will continue to be.
Yeah, it must be a huge adventure. You've spent 7 years in practice before moving into the corporate world with Pfizer, and then back in 2005. And I was thinking, like, you're a vet, and then at what point did you think that you wanted to pivot from clinical into industry?
Yeah, I would say that there wasn't a single pivotal moment. You're right, I was in clinical practice for seven years or so throughout Australia, and I did the usual stint in the UK as well as acting as a locum vet. I really did enjoy clinical practice. I enjoyed the problem solving. I enjoyed the pet owner, and I was largely in companion animal practice, but the pet owner interactions. I enjoyed the team work, working in practices with alongside vet nurses and vets and etc. So all of that was really interesting. I think what I got to though after 6 or so years is I had done some postgraduate training, and I thought I really wanted to just continue to challenge myself. And like how far, just always not necessarily chasing a particular role, but how far could I push myself to learn new things and try different things? And I thought the next logical step for me when I was in clinical practice was to own my own practice. And at that
Yeah.
time in Sydney, that I don't know if it's changed. Shannon, you would know better than I, but that's no easy undertaking. Just get either buying a practice from someone else, the real estate costs, all the rest of it was just really challenging. And I also didn't necessarily want to go into specialty. So I
Mm.
was actually, but I didn't want to give up. Again, I love this industry, and I really thought I invested so much in developing this skill set. I didn't want to walk away from it. So I remember I was in a practice and in Sydney, and the Pfizer Animal Health rep at the time used to call in and see me, and he mentioned, look, we've got this technical role. You should apply if you're interested in just, I think you would enjoy working in industry. And at the time I thought nothing to lose because I was interested in exploring what could a career in animal health do, what could it look like, but also I thought if I don't like it, I just go back into practice. That skill never goes away. So yeah, I moved over into Pfizer Animal Health at the time, and now 21 years later, here we are. So it didn't. I never felt the need to go back into clinical practice, but I've never really, in my mind, I've never really left it because everything that I do on a day-to-day basis always seems to link
Sure.
back into that setting. So it's
Yeah.
been an enormous benefit to have that background.
I get asked this question all the time. I've got vets that are vets and they come to me and they're like looking at some of these things of what is there anything I can do or go study? And I close my eyes and I take a deep breath and I'm like, look, sometimes I've seen some vets that have been really good. They've gone off and done an MBA. And if you want to go down marketing or you want to go down certain commercial aspects, sorry, having a marketing or that sort of commercial educational background by getting an MBA has been, from what I've seen across the board, a lot of them, because you're going to go invest so much money into an MBA, you want to go down
Yes.
that path. So they,
Yeah.
and I'm like, but it's definitely not for everyone, but I've definitely seen it help. So I'm like, I don't want to say this is going to do all these things, but the ones that have actually had really good results and have had multiple of them go, I'm so glad you told me to do the MBA because now I wouldn't be here if it
Yeah.
wasn't for you. But I know you're
Yeah.
certainly one of those people that went and did an MBA, and I was just really keen to understand how crucial do you think it was having an
Yeah.
MBA to bridging that gap from clinical sort of thinking into sort of commercial sort of thinking as well.
Yeah. Look, and totally get I possibly would have been one of those people, Shannon, that would have asked you that same question. Because I remember for a few years, I was like, should I, shouldn't I do it? And my first role in industry was in a technical role, of which you
Mm,
don't need an MBA to do that. In fact, the more specialized you are in your technical background, the better. But when I sat in that technical role for a couple of years and worked alongside marketing and thought that looks of interest to me, then I started doing my MBA while I was working at Pfizer Animal Health at the time. It certainly helped me develop a more rounded commercial, I guess, skill set, right? I would say that in terms of its difficulty, it is nowhere near as difficult as a veterinary degree. The veterinary degree and my pharmacology postgrad study was by far technically, intellectually more difficult. So I don't think the MBA is an intellect. To me, it wasn't a real intellectual challenge. It was a challenge on balancing work life, rounding out your skill set, all the rest of it, and building that network. But it wasn't technically difficult. But you're right, it's expensive and it's a time commitment. It took me 4 or 5 years, I think, because I was
yeah.
working at the time, but it was enjoyable. And I would say that you're right. It doesn't guarantee you a path in a commercial role or senior leadership, but it certainly is no detriment. And
Mm,
when people ask me, and vets ask me that same question, I always position it in a way that it's not just about you applying for a role. You would be applying against a cohort of other applicants, of which others will have an MBA. So to some degree, it puts you alongside others to be able to compete for the role. You're not going to get that role just because you've got an MBA, but
of course.
it's not going to disadvantage you, and it will at least put you on a par with others. So it's just these skill sets and additional degrees, etc., just put you in a better position to compete. But you're
Yeah.
exactly right; they're no guarantee.
Yeah, I know. It's always hard. I'm always like, that's why I shut my eyes. And
Yeah.
try, what do you want to do? What's your vibe in terms of what gets you up and wakes? Do you like creative writing? Do you like doing these things? Do you like the
So
dotting your I's,
true.
crossing your T's? There's
Yeah.
because of vet, I feel like there's so many there are options as a veterinarian to come into industry and there's different channels that you could go down and
So
be
true,
amazing
Shannon. I
at.
mean,
Yeah.
I remember in my undergraduate, one of my last years of undergraduate, one of the lecturers at the time, when we all used to laugh about it, but he would always say the vet degree is a broad-based skill set. It'll just
Yeah.
unlock this career. And yet when you're doing a vet degree, or generally the reason what you sign up to do a vet degree is you're going to become a vet, right? And so it took me a lot to, what do they mean by that? We're all going to become vets, and the majority of us did in the first instance. But you're exactly right. That skill set that you get as an undergraduate is absolutely applicable in a broader business setting. And I got to that point, those questions that you asked, I think are really valid, where you say, what is it that excites me? What do I want to do when I get up in the morning? And I certainly moved from a point where I had that technical skill set, and initially that first role was really about providing technical support for vets using the Pfizer Animal Health portfolio. It would be training and education externally and internally. And then the more exposure I got to marketing, I was like, and strategy, I was like, that interests me.
Yep.
Forming a future for the industry, assessing product fit against our industry, deciding in Australia at the time what products would solve what problems for vets, how do we need to shape certain segments. And that sort of started really interesting me. And so that was the evolution of that. But you're right, you have to ask yourself, if you're looking at a career in the industry, what excites me and what does this pathway potentially unlock? And it's certainly a very varied outlook for sure. I chose a commercial path, marketing and then general business management, but you can equally go into pharmacovigilance, you can go into R&D. There's a plethora of options, and reg. And certainly, again, there's a lot of people that come into industry that don't have a veterinary degree, and they can do most of those roles. They can't do a technical role, but a veterinary degree I view it as a bit of a superpower for any role. There is nothing that you couldn't do with that. Whereas if you don't have that vet degree, there are certain things you are at a bit of a disadvantage on, or you actually can't do. So it's a huge unlock and a bit of a superpower if you want to apply it in a different setting.
And how hard is it, like having a thinking of a clinician from a vet sort of mindset to start thinking across to going down that sort of commercial strategist type mindset?
Yeah. Look, you meet lots of potential applicants, right? So you would have a really good perspective on this. I didn't find it difficult because, again, when you're in practice, often what you're doing is your problems, you're trying to be pragmatic, you're thinking what could go wrong in this setting, how do I better get an outcome here? It's those broad-based skills that you're just applying in a more sort of commercial or business setting. Leadership, the behaviors and skill set and capabilities around leadership. When you're in practice, it's firefighting, it's problem solving, it's building team engagement and culture, it's communication. All of those skill sets are exactly applicable in a commercial setting. So I didn't find that difficult, but I certainly know some vets, and it goes back to your question, like what gets you up in the morning, some vets who just thrive on the deep technical expertise. And there is a role for that. There's an absolutely really valuable role for that, but that doesn't necessarily, is not a natural fit for general business management, for example. So it's just about finding what's your passion, what gets you motivated.
Yeah, I think so too. Now, one of the big things I wanted to get you on here, because I don't know, you've been all around the world, come from little Australia, and you've led teams in Ireland, US, UK. Obviously, you're in Asia now and Africa. But like when you first went overseas and you US, UK, and that, what was one sort of cultural nuance in management that caught you off guard when you first moved overseas from Australia?
Yeah, look, I think you're right. It's just fascinating. Before we talk about purpose and what interests you, before I embarked on a bit more of a global career, my husband and I always enjoyed traveling, right? And experiencing other cultures. And I was always curious and open-minded from that perspective. Australia is clearly a long way from anywhere, so you're a bit limited in terms of how often you can do it. But we always had that passion. And so our first move was to Dublin, which is remarkably similar to Australia. It's a very easy transition for an Australian because there's a lot of cultural similarity. The Irish sense of humour, the way of working, quite similar in many respects. But of course, Ireland is part of the EU, and there's that whole perspective around being a European trading bloc and a market like the EU that's quite distinctly different. But I would say, to your point, in every country that I've operated in, there's always cultural differences. And I think the key for me has just been around being respectful and inquisitive. It's not about imposing my background and the way I
Mm.
do things onto a different country. If I'm living now in Dublin or in the US or in London, it's not about me saying this is the way I was brought up or this is the way I operate, so I'm just going to continue operating that. It's like, how do I bring those very unique Australian skill sets, and they do exist, and we're renowned for a few capabilities in the global setting. How do I bring that to add value, but being totally respectful of how US culture, business culture operates, how it operates in Asia. Asia is very hierarchical, deferential. That's not the Australian way. We're pretty
Mm.
pragmatic. We're pretty egalitarian in many senses. So that's been an adjustment for me too, because I'd like to be much more amongst it all. I like to hear the good, the bad. I like to be challenged. I like to, and that
Yeah.
you won't get that naturally. So it's how do I respect that culture, but also bring my unique Australian lens to it as well.
And what about, like, certainly with Asia, there's obviously I've traveled around, I've been there, not all, but a lot, and there's very different culture, sort of diversity within
Yeah.
these countries. How do you adapt your leadership and style to remain effective across such different markets?
Yeah, you're right. We often say Asia, right? Forgetting that there's dozens of languages. Even within a country, there are many languages and different cultural nuances. So the complexity and the differences are quite significant. And so I'm always mindful that when I'm visiting, and whilst I spend 50% of my time visiting in this region, I am visiting, right? There's only so much that I can get a sense of when I'm there for 2 or 3 or 5 days or whatever it is. And so I'm always cognizant that I don't make too many judgments based on very limited interactions. I understand there's
Sure.
an entire cultural framework, there's a way of operating, there's a business culture that I'm not going to be privy to in such a short, even though I might visit 4 or 5 times in a year, I'm still understanding that this is a limited interaction. So I like to believe, and I try to hold myself accountable, that I observe a lot, that I immerse myself in a room. I try not, as much as my role requires me to do a bit of talking and to engage, I also like to ask questions and just listen and receive. And I think there's a lot of value in observing people and watching the dynamic. And you can only get that when you're sitting amongst a team and you're in that
Yeah.
market. You can't do it over Zoom and you over a 1 hour call. You have to sit there, see how people are interacting with each other. What's the dynamic like here? How are we interacting with our customers? What's the relationship that we're building? And that sort of just, again, comes back to being sensitive, emotional intelligence being applied in practice, and just trying to listen more than speak.
Yeah, okay. You said earlier that you and your husband do a lot of traveling, and obviously sometimes, like, when you go on holidays and you travel and you go to countries like Asia, from a business perspective, now that you're in that hot seat of being a manager, and now that you're listening, is there anything that's not shocked you, but had some, maybe like a little sprinkle of aha moments about, from a commercial perspective, about managing in Asia?
Yeah, sure. Yeah, look, one of the reasons I was really interested in this particular role that I'm doing now is that my background, and certainly the Australian experience, but also working in Dublin and working in the US, these are very Western, highly medicalized, developed markets from an animal health perspective,
Yeah.
quite often corporatized, industrialized from a livestock perspective. And there's a similar-ish theme to it. Asia and Africa, to me, there is a lot of that really emerging market dynamic, which is
Yeah.
incredibly exciting, but a completely different challenge, right? And so if I think about in some of our more developed Western markets, say Australia, where you've got a parasiticide segment, in most
Mm.
markets, parasiticides are the largest segment in animal health. And so in many markets that are very highly medicalized, that's about trying to drive compliance with the pet owner. They should be using more than 3 doses a year if they want to get the full coverage. And you're trying to drive differentiation amongst a sea of competition. In emerging markets, you're actually trying to educate the public on the benefit of preventative healthcare. That's a totally different dynamic.
Yeah.
You're not talking about why you should use Simparica Trio, you're talking about what does worming and flea treatment look like? What value does that provide to your pet, to your family? And you really have to go back to a very foundational level. And Australia went through that 30, 25 years ago. And so now
Yeah.
to be back in these markets and saying, okay, they're rapidly growing, but at the same time, they're only emerging in an animal health perspective.
Okay.
And it's like such a different challenge and super exciting, but it really makes you go, okay, we're not talking about how many ticks does this particular product cover. We're talking about zoonotic disease for children and why preventative healthcare is really important. So it's really fascinating from that perspective, challenging in many ways.
Yeah. I can imagine. I can imagine. And one of those, not cheeky questions, one of the other things is like, for all those Aussies looking to climb the global ladder like you have, which markets or countries do you think might offer some of the best development opportunities right now?
Great question. Look, I would say two broad themes, I guess, to look at if you're thinking about a global career. One would be to the US, and the US has, in any way you cut it, it's the largest animal health market in the world. It's the most highly medicalized in many ways, most advanced. It's the largest. And so the opportunities from an animal health perspective are massive because of its scale. However, it's only a single market. And if you truly want a global perspective, markets like in Asia are incredibly exciting. And because they're emerging and dynamic and fast moving, they can set you up really well for a global opportunity anywhere in the world.
Mhm.
Europe is also really interesting, but Europe operates much more consistently, and at least the EU, than you would find in Asia. So okay, I might be biased because I'm based in Singapore right now and I'm looking
Yeah,
after Asia and Africa, but I would say that it does give you a broader skill set than potentially just moving straight to the US or into the EU.
interesting. Okay. I like that. I like it.
It's fun.
Yeah, yeah. You recommend it?
Absolutely.
Yeah,
Again, it doesn't come without sacrifice, right? And but
100%.
nothing ever does. And so that's where when I talk to people about potentially looking at global options, sometimes my first few moves didn't make sense financially. My husband's career absolutely took a massive hit. He hasn't been able to get a role anywhere near the seniority he had in Australia. And in fact, in some countries we've worked in, he hasn't been able to secure a role at all. So that's a hit. I
Yeah.
also am very close to my family. We've had to leave our family in Australia, and you miss all the milestones and all the other events that happen locally. And so you have to balance, only you can make that decision from a personal perspective. You have to balance those clear things that you need to give up against what is a more of a global career and the opportunity. For me, and on balance, absolutely the global opportunity from a personal and professional perspective has been incredibly rewarding. The opportunities in moving into a global career cannot be even bridged halfway from Australia because Australia just doesn't have the scale, it doesn't have
Yeah.
the roles, etc. So to really get different roles and different opportunities, at some point, if that's what you want, then you're going to have to look at that global opportunity, but it doesn't come without sacrifice. And you just have to make that personal trade-off yourself. And if you can't, for whatever reason, make that trade-off, absolutely fine. But then you just know that you're not going to be able to unlock those opportunities that a global career
Yeah.
provide.
Yeah. And I'm going to ask a sort of one of those little management nuggets maybe you might have picked up along your global way. Now, you were chief of staff to the CEO of Zoetis New York. You would have seen leadership at probably the highest level in animal health. Is there one little trait that separates like a good manager from a global executive?
It's a great question. Yes, working for the CEO, she was actually newly appointed at the time that I started, and seeing a CEO transition like that, seeing new strategic kind of framework being put in place and kind of driving some initiatives was fascinating. All at the same time as COVID as well. So watching how people navigate something like that was
I
fantastic.
forgot.
And yeah, it was a real thrill and privilege to be able to do that. And it did, you're exactly right. It did give me this opportunity, as did a number of my roles in my career, of observing. There's so much power in so many meetings I sit in and just, oh, I see that's how that particular leader deals with that challenge. I love the way they handled that. Or, gosh, oh, that's a really interesting way of addressing that particular challenge. And what would I take out of that? So I've been in a really fortunate position to be able to observe and write what I think are best practices and try and incorporate that into my own skill set. A couple of things come to mind immediately. One would be what I would like loosely refer to as an enterprise mindset. So what I mean by that is people who are able to remove themselves out of a personal or even team-based perspective to think going from what's best for me or what's best for my team to actually what's best for the business or the strategy or the intent. And that might mean I have to personally sacrifice something. That was, I think, is a real differentiator. People who are able to remove themselves and their own personal gain and go, actually, I see there's a better investment over there. I'm not going to benefit out of it from this perspective, but I believe in the vision or whatever we're trying to achieve. And that means I have to make a trade-off, and I'm willing to do that. I think that really sets people apart. And then I think the other thing, which is a little more intangible, is just the emotional intelligence piece. Being able to, and that I don't even know if you can train that, but the people who are like can read a room or can, when they're even speaking and addressing a senior team, or it might be a customer facing team, and be able to pick the sort of the cultural nuance at the moment and see, okay, I see I'm losing people here, or I get the sense that there's discontent here. I need to dive on that, or I need to adjust my way of speaking to address the concerns. That sets real leaders apart from my observation. You can see it when people have got that emotional intelligence. You're like, oh,
Yeah.
but it's not even about the sort of intellectual intelligence, right? Though I think
Yeah.
they possibly go hand in hand. It's just the whole being able to adjust based on what's going on, contextualize what's going on and adjust, I think is really critical.
Wow. Okay. Yeah. It's good. Good.
You don't even, so you would see it too, right? So you come across people and you're like, there's something they've got something there. You know,
Yeah.
it's like intangible, but there's something there. I think that, yeah, part of that I put down to people who've got really good emotional intelligence and can adjust.
Yeah. I like that. Yeah, it's good. Now, from a little bit of business side of things, apart away from just Stephanie, from Zoetis, it's obviously it's a global engine of innovation, but a vaccine or a diagnostic developed in the US has to actually work in like for a vet in regional Queensland or a farmer in Vietnam. How do you ensure that global innovation doesn't get lost in like translation and actually creates tangible impact in these diverse local markets?
Yeah, look, it's a great question, Shannon. I think it actually speaks to a little bit of what we've been talking about in terms of a veterinary degree being a bit of a superpower for people potentially,
Yep.
because you're right, like the best innovation has to be able to translate in a really practical sense. And I think part of the value or the benefit of being a vet in these sort of contexts is being able to apply that practicality. So to be able to understand that if you've got monoclonal antibodies, which is a whole new area of innovation for animal health, at the very pointy end often of therapeutic interventions in pet care, how does that translate into a market like India, where basic preventative healthcare and rabies is not even completely in control? And so being able to understand who the target customer is, what value does this serve, and then being able to put that local context around it. Do we need to increase education of the veterinary community? Is it a pet owner awareness piece? Is it a distribution challenge that we've got to deal with? Is it a pricing barrier that we need to overcome? So it's taking those global concepts, being able to put the local perspective on it. And for that, I work so closely with my leadership teams in all of the markets, and also the customer facing teams, where they'll say, listen, this is not going to work here unless we address 1, 2, 3 items. And so it's just
Yep.
getting that local context, I think, is really important, because if you can't make it land from a local perspective, it's not going to land at all. And that's everyone's loss if that's the case.
And if the technology is only as good as the people using it, right? So from
Yeah.
like a bird's eye view as a regional president, What are you seeing in terms of building the capability, or what does the industry need to support and upskill the veterinary workforce so they can actually keep pace with the level of innovation?
Yeah, this is, I think, a real challenge. I think in many instances, especially for R&D companies like Zoetis, one of our biggest areas of focus is the interplay between the innovation, the latest therapeutic, whatever it is, and the vet's application of that in practice. Because if you think about it, most vets, certainly in Australia and New Zealand, but around many markets, are extremely pressed for time, right? They are dealing with emergencies coming through the door. They might be dealing with labor constraints. They can't get enough staff.
Yeah.
They've got pet owner demands are only increasing. They've got livestock customers who might have profit issues or cash flow issues. They're dealing with many other things. Their headspace for thinking about the latest innovation, whether it be a diagnostic or a therapeutic or some sort of preventative, is very limited. So we have to make sure that these kind of solutions are grounded in some practical reality, and they're really solving a problem for the vet or whoever the end user is. And so for us, a lot of what we do in the R&D, when we're initially working on the R&D of potential new products, is like, what are we trying to solve here? And do we need to continue to challenge ourselves to say, is it truly solving the problem we set out to do, or is it creating another headache for the vet? If they've got to really think
Yeah.
about how do I get this into a pet owner, or the price is too high, or whatever it is, we need to go back and address those foundational aspects. So yeah, you've ultimately got to continue to challenge yourself to say, how does this work in practice, and how do I overcome some of those barriers? Because the vet's ability to give time to complex changes is very limited. They've got a lot on their plate, and it's being empathetic to that, I think.
I think this is further on this same area, but you've seen the industry from the lens of New York, Dublin, now the entire APAC and Africa region. Would you say, is this challenge of workforce support the same everywhere, or do you find the needs, I don't know, of a vet in London fundamentally different from those in an emerging market?
Yeah, really good question. I think to directly answer your question, I would say yes, they're very different. But there's definite core themes that are common. And that issue around translating eye science, technical advances,
Mhm.
innovation to a member of the public, be that a farmer or a pet owner or whatever, is a real common challenge. And companies like Zoetis have a partnership role to do to provide vets the ability to translate science into something that's impactful for a pet owner or a farmer. But then there's also some distinct differences. So, for instance, in the UK, because of changes as a result of COVID and exiting the EU, they've got incredible workforce capacity constraints. There's just not enough vets to service the pets that are and the demands of pet owners, and the ability for vets to be able to spend a lot of time moving into the next therapeutic area is again really limited. They're under
Yeah.
enormous pressure as well, so there's a lot of work, there's a lot of mental health challenges in general in the UK, but also in the veterinary profession. And I'd say that is not the same in all markets. It used to be the case in the US, but the US put on a lot of new veterinary graduates, and they're addressing that constraint now.
Yeah.
But in emerging markets like in China or in Africa or in many parts of Southeast Asia, the consistency and level of veterinary graduates and their ability to practice at a high level is very variable. And so we come into some markets and work with our vets, and they may have vets, qualified vets, but they may
Yeah.
have no ability to do surgical interventions, or they may only limit themselves to vaccination. It's very, very dependent upon the regulatory system and
Okay.
the veterinary school system. So it's, yeah,
Wow.
that's quite varied. Yeah, it's fascinating, but it adds a whole other lens of, oh, okay, we've got to address that issue. In some vet
Yeah.
schools, they're not taught about preventative healthcare, right? They might have very limited pet care, dog and cat streams, and so we've got to work with the vet schools to try and upskill and uplift that level of education as well. So yeah, there's some core themes that are common, but then there's a lot of variability as well.
Okay. I was like, when we talk about I don't know innovation and products before, it reminded me when we had a conversation. It was obviously years and years ago. At the time, Simparica Trio hadn't come out, but I think there was like whispers that it was coming, and it was like seen as the holy grail of you could get these three things in one tablet. It was just going to be that's the greatest of innovation in companion animal health since. And I guess obviously time's moved on and it's been around for quite some time now. But if you're like a crystal ball, like in there looking at sort of some future products, are there any like cool product trends that you could like of shifts of farm that you reckon are going to be absolute blow up in a couple of years?
Yeah, look, it's a great question. I think because parasiticides and like flea and tick and heartworm in Australia are so universal, like every animal, every pet, has potential exposure to those. The parasiticides in particular are always prone to the blockbuster innovation. But I think the really exciting part for animal health is, and it's not dissimilar to the path that human health has taken, which is monoclonal antibodies as one example, where you've got quite precise targeted science, but now in more, for want of a better word, niche or specific disease states. So we've got monoclonal antibodies coming out in the area of renal disease. And if I think back on my time in practice, feline renal disease is just one of the, it's an unmet need in terms of we need to do better for cats. I think the statistic is something like
Yeah,
60% of cats over the age of 5 have some sort of degree of kidney impairment, and that only
yeah,
progresses during their life. And we've got very limited therapeutic options to improve the quality of life or delay disease progression. Monoclonal antibodies look set to transform that entire space, right? And cats will be the beneficiary of that for sure, and obviously pet owners as well. But then monoclonal antibodies can also be applied in cancer treatment. And so there's a number of monoclonal antibodies coming out in cancer, specific targeted cancer therapies, which previously had only protocols based on human medicine that are very difficult to administer and require a lot of work health safety issues, and the outcomes weren't that great. Now you've got
yeah.
injectable monoclonal antibodies that can be administered potentially by a GP vet. This is transformative in terms of unlocking different outcomes for pets in the world. And so I think, and all of those monoclonal antibodies, at least the science, has been the case in human medicine for more than a decade. So that science is not new in
Yeah.
its general sense, but it's new, still new in its application in animal health. And I think that's going to be really exciting in many therapeutic areas.
I've always geeked out on all the new stuff that potentially is coming out. I just find it
Same,
so interesting.
right?
Yeah.
I missed my days in practice when I was 6. I'm like, oh my God, I would have killed for
Yeah.
a solution like that. And I don't get to practice anymore, so I don't see it. But yeah, the science is amazing. It's pretty cool.
Is there one thing that stands out like as a piece of global knowledge that you think would bring home to Australia? So if you coming home back to ANZ as in a leadership role, is there anything you think you'd some things you'd bring back and maybe some other people listening to this might think this is valuable?
Yeah, look, I think that having a global career and sort of some experiences outside of Australia is really valuable in terms of coming back to Australia and having a broader outlook, right? Wherever you're based, you're always pretty singular in this is my scope of influence, or this is the market in which I operate, or the business in the town I'm operating in, or whatever. When you've had a experience in multiple markets around the world, my hope, and at least my experience when I do come back to Australia, has been you bring that broader perspective back. You realize, okay, it's not all just about this. It's actually all of this. It's in the context of a bigger perspective. And I think that global perspective is invaluable. It allows you to put things in perspective. It allows you to weigh up what's really important, what's not important. I think it also builds resilience. Just moving around, having a global career, you inherently have to be able to cope with things that you wouldn't have been able to forecast. And so that resilience, I think, is really valuable in coming back into a market like Australia.
Yeah, okay. And is there anything on that if they haven't got the global perspective, but they were trying to think globally but not having it yet? Is there anything in terms of I can hear that word saying, yeah, all right, I've got out there, I've got it, but how do you bring it home? to someone else who
Yeah,
doesn't quite doesn't have your experience, doesn't walk your path before and had that
sure.
exposure. How would you teach that, or how would you try and think this, how you kind of got to think like this?
Yeah, look, I guess one, it's a really good challenge. One way, and I guess a mindset that anyone could take, without having a global career, could take into a role is just giving yourself different challenges, right? So
Mhm.
learning new things. It might be an MBA. You may not be doing it for a particular career outcome, but you're putting yourself in a position where you don't know stuff, that you are going to be working with people that work outside of the industry, outside of animal health. And so you're exposing yourself to different industries and different ways of thinking.
Yeah,
So learning new things, I think putting yourself in positions where you might be uncomfortable, but
yeah,
it might be, you might even be in practice, but changing practices or working in a different team. All of those perspectives, I think, whenever you're forced to lean into something that is unknown, it does force you to practice those resilient skills and also
yeah,
the empathy piece, right? It's easy to shoot from the sidelines and say people need to do it this way, or I disagree. But once you start getting exposed to different ways of thinking, different ways of looking at things, then you build a bit more empathy and you're like, okay, I'm going to come into this with eyes wide open, listen more. I'm going to I'm going to be in the awkward position where I'm not the expert, and that's
yeah,
okay. I'm all right with that. I think that
yeah.
it's those, you can still pick up those skills and capabilities just exposing yourself to different things in your current role, really.
Love that. And I can really relate to some of the, yeah, maybe not on the level that you have, but some of the things I'm trying to explain to some of the candidates in terms of, yeah, picking up
Yeah,
that extra little bits of, trying to
yeah.
move to
And
another role and what they need to get to and how and why.
exactly. And again, Shannon, like my particular career path, it's everyone's career path is different, right? There's
Yeah,
no right or wrong or best or worst or whatever. But to your point, just keeping your mind open to other opportunities. I remember when I was in my first technical role and I was thinking about marketing, I think for a year or two, I probably resisted it. I was like, oh, I don't want to give away this vet degree. Like, I really love what I do and I want to remain as a technical expert. But
yeah,
then I was like, okay, what's to lose? What's to lose? And if I don't like it, I can always go back. And I think whatever your particular career path looks like, I don't want to get to the end of my life and then have too many regrets about career decisions. I'd rather have tried things and learned from it than never know what could
yeah.
have happened. And I think everyone can benefit from what's the worst that could happen here? Take the risk.
I know we're getting to the end of our times, but I want to quickly ask a couple of quick questions. Favorite city you've worked in?
Oh, oh gosh, that's really tough. One of the things I would say is that having worked around the world, there's no perfect
Yeah,
place. Australia's pretty good. Once you worked around the world, you're like, yeah, we do have a really good balance of lifestyle, but also outlook on life and good work ethic. So Sydney will always be home to me, and Australia will always have a place for me that I hold really dear. But I've loved New York is fabulous and exciting. London, I loved. Singapore, the business community here is really open and welcoming. So yeah, it's all. I worked when I was based in London. I was overseeing part of the role was overseeing the Nordics, and Nordics is a fascinating, lovely place
yeah, I
to
bet.
do business in as well. So yeah, there's so many great places, but Australia's pretty good, pretty
Okay.
tough to beat.
All right, all right. It might be casting the memory way back, but is there the most memorable animal you've ever worked with?
Oh, good question. I remember when I was doing locuming work in the UK and they wrote on these were 5-minute consults. It was just a nightmare. But one of them was to see a chipmunk. And I thought chipmunks were like a cartoon character. I didn't actually understand, let alone the fact that I'd never studied anything about medicine of chipmunks. The
Yeah,
chipmunks threw me a little bit. I didn't even know how to actually handle a chipmunk at the time. But then in Australia, when I was working in Canberra for a couple of years, we did work for I think it was the Canberra Zoo at the time. So we used to
yeah,
see the owner there used to bring in a lot of interesting animals. And I always like to, when you're working in the US or in Europe, they think Australia is a certain way. But to be able to say that, oh, yeah, no, we did treat kangaroos and yes, snakes and whatever is always gets everyone's attention. The kangaroos were pretty cool. A lot of
Yeah.
ticks on them. So I remember that. There's a lot of ticks. They're pretty horrible up close, but it's a good one to be able to pull out in a global perspective.
What about one book resource that every or any aspiring leader should read?
Yeah, so one thing when people in the business that I oversee at the moment get a promotion into a new role, I always send them like a note of congratulations, but give them a book that's called The First 90 Days. It's by, I think it's Michael Watkins.
Okay.
And it's just a really practical book for people who are transitioning, especially in a business environment.
Yeah.
But it just has really practical ways of like how you make an assessment of the new role that you've landed in, like where should your priority be? How do you have impact? Really pragmatic. And often what I find, at least in our business, is that people are put into new roles, as I was, my first couple of promotions. I was like, can someone tell me what does good look like? How do I, please tell me
Yeah.
this needs to, where's the handbook for this role? And of course, there never is one. But I just find this book is really practical for whatever role people are stepping into, just to frame up how they should view their first few months for success in the next few years.
The First 90 Days by Michael Watkins.
Yeah.
I haven't read it, but I want to now. Yeah. Thank
Yeah,
you.
it's a
Thank
very
you.
quick read. It's not going to, won't take you too long, but yeah, hopefully you'll find it practical as well.
Look, I know you're an Aussie at heart. Do you reckon you'll ever come back to the ANZ, or has the global or
Yes.
cultural stage claimed you forever? We're going to
No,
see Stephanie
I,
Armstrong back in Oz.
yeah, I'd love to eventually come back to Australia. I think the compromise for me is just the career opportunities are definitely more limited in Australia. And I've been, again, very privileged that Zoetis and Animal Health has given me such a great number of roles over a number of years. But Australia, when I still oversee it now, I work obviously with a team in Australia, but I come and visit and I love it. It's a great part of the world. So eventually we want to get back. I don't
Yeah.
know if it will be in my retirement or if it'll be, but
Yeah.
yeah, it's a great place to have home.
The final question, and I think any vets listening to this, or so young vet students of today, sitting where you were 20 years ago, do you have any pieces of advice that were, look, I speak to some vets, they're in their final year and think, I don't even know if I want to be a vet when I grow up, but I'm so far into this vet degree that I want to
Yeah,
finish it, but I don't know if I want to
yeah.
be a vet. Is there any advice you'd give to any young sort of veterinarian?
Yeah, that kind of breaks my heart because the degree is so damn hard and
Mm,
expensive these days to do that you hope that people aren't suffering through it. But to your point in our earlier conversation, even though I think the degree sets itself up to be more vocational, i.e., you will be a vet at the end of it, I can absolutely tell you that is not the outcome. And certainly of my cohort of friends who went through vet school together, we've got people with careers like me to, I think there's a pilot in there, there's people who've gone back and become teachers. You can do anything from there. But I
yeah,
would absolutely say that the degree, completing the degree, is a really solid basis for anywhere that you want to go. And if you want to stay in the industry, like you like animal health, even if you don't want to be a vet, a couple of years in practice is incredibly valuable wherever you want to go. Even if you want to pursue an R&D path or you want to go into general management, like I have, having a practical grounding to what is a quite a theoretical degree is also really useful. Yeah, I think it's a really powerful degree. It's sometimes hard to lift your head above the sea of challenge that you have trying to complete the degree. It is a really tough degree, but it's
yeah.
absolutely worth it. And I would do it all again, even though I'm not a vet and haven't been a vet for 20 years. I would certainly do it all again for sure.
Oh, amazing, amazing. That's it. Thank you so much for coming on the
No,
Animal
thank
Health
you,
Show.
Shannon.
It's so good to hear from you and catch up with you again.
You
It's
too.
been a long time.
Yeah,
I
hopefully
really
it won't
appreciate your
be,
time.
no, my pleasure. It's great to talk to you. And I know that you do incredible work for the industry in Australia and New Zealand as well. Please keep people engaged in this industry. It is, I know you're passionate about the industry. It is a great industry and we need a constant stream of really engaged, passionate people, because it will make an impact into the future. Yeah, anything I can do to support that, I'm all ears. But yeah, really appreciate the chance. Hopefully it won't be at another conference 10 years from now that we see each other in
Yeah, I
person.
know.
But
Hopefully not.
yeah, but
But
no, really
amazing.
appreciate it.
Thank you for your, yeah, I know you've got a super busy schedule. Thanks for
No,
squeezing me in.
no, not at all. Thank you so much. You have a great day, Shannon.
You too. Thanks, Stephanie.
Okay, see
See
ya.
ya. That was Stephanie Armstrong, the president of Asia and Africa at Zoetis. I think the biggest takeaway today is that the veterinary background isn't a limitation, it's a launch pad. Steph, thank you so much for being so generous with your story, your time. It's rare to get such an honest look at the path to global leadership. I know our listeners on the animal health space are going to be chewing on these insights for a long while. If you enjoyed this episode of the Animal Health Show, make sure to subscribe and share it with your colleagues who are looking for that next step in their career. You can find more industry insights and career opportunities at s8.com.au. I'm Shannon. Thanks for listening, and we'll catch you next time. Thanks so much for tuning in to today's episode of the Animal Health Show by S8. If you've found the value in this conversation, please share it with your colleague, an industry mate, or on social media so we can keep the discussions moving across the sector. If you'd like to get in touch, all of our details are in the show notes for today's episode. I thank you for listening, and I look forward to chatting with you again in the fortnight.